I have to say I am extremely excited to be here. Pune is one of my favorite cities. I've had a chance now to live in India for the last 6 years. And from the day I arrived, I jokingly said it, you may never get rid of me because I love this country. I love the opportunity. And I hope today, if I could just leave you with two things. I know I'm somewhat singing to the choir because you're all in the healthcare space and excited about entrepreneurialism, but it's estimated there's 5.8 billion people in the world that lack access to quality health care. 5.8 billion. 80% of the money that's spent in health care goes to less than 20% of the world's population. It is a complete disgrace as a society and as a human race. As a company, we recognized this and said, let's go try to do something that is disrupting, that would make healthcare more accessible, more affordable, and completely in line with where I think all of us want to be, is deserving of the same quality that I would get if I went into one of the world's best healthcare systems. In India, we have all these problems. We lack access for about 600 million people. We lack quality, very inconsistent quality. And I would even add something that I'm also pursuing with the national health organizations is the conflicts of interest that happen around a patient. Technology can bring about these fundamental transformational changes. At the heart of this, it does start, honestly, I believe this, that it starts with the bright minds that are here in India, the entrepreneurialism. And to me, there has been no reason that I can find that India shouldn't be a net exporter of healthcare technologies, because we have the most Darwinistic market to serve here. You have to be extremely affordable. India's healthcare system is by far the world's most affordable healthcare system, bar none. Now, the government and all of the populist discussions wants that price to be even lower, but there is a fair amount of cost that comes with serving disease. But take what we already know. We have a very cost-sensitive, we need to serve a larger population, so cost, the ability to access the rural populations, and thirdly is let's use technology to make the quality happen at that more affordable, more accessible point. Are you with me on that? Okay. So let me get started. I'm going to try to, here we are. I'm going to try to give you a little bit of flavor for some of the things that we're doing, and also to hopefully invite you to understand how, even though we are a large global company, I would argue that we're a very strong domestic healthcare company here in India, and we want to work with partners in the ecosystem. Okay. Huh? Oh, sorry. Yeah. You know, electricity is always a wonderful thing. There we go. So, when we think about the power of digital in the healthcare systems, we're looking at three very fundamental outcomes. And technology, and having been a technologist most of my life, I love technology. I think technology can solve any problem given enough time and perhaps enough money. But technology in the healthcare world needs to translate into a patient's outcome or a system's outcome. Too often I find, we love doing these hackathons and we get together with the medical community and the engineering and technologies community. And the first temptation is to jump to a solution, when in fact what we need to do is spend a lot more time understanding what the real problem is that we're trying to solve and who we're trying to solve that for. Is it the physician? Is it the nurse? Is it the ward boy? Is it the patient? Is it the patient's family? And I would encourage you in healthcare, it's a fairly complicated workflow to really understand what problem is it that we're trying to solve and for whom before you jump into how we're going to solve that problem. So at the heart of this is how do we improve outcomes of health for people at the individual level? That's our starting point, our kind of ongoing mantra inside. The second is, of course, to make it more affordable for everyone, we have to find efficiencies in the systems. You know, the world has gone digital. Well, except for maybe 3 sectors: the arts, education, and healthcare. Healthcare, for lots of reasons, has been slow to adopt digital. And I think it's one of the, and will be, the most tectonic shift in the healthcare delivery system. What we know and see about healthcare today, we will not recognize in 10 years. In 10 years, nobody will practice medicine without augmentation of a computer and computer decision-making. We as patients will be turned around and we'll be directing our healthcare plans. We'll tell the doctor when they'll see us. That's how fundamental digital is going to be to the healthcare system. And the good news is that'll be good for all of us, as well as the bill that either a government or us as individuals will need to pay. The third is about, and a very particular point I want to make about accessing not only just the technology, but accessing the expertise that's needed to go with that. We're working on a very broad project to build a national cancer grid in India. Of all the things we've discussed, the biggest challenge we're going to face is where's the expertise? Because we have less than 2,000 oncologists to serve 1.2 billion people. So that is another interesting idea, and I think, again, technology is going to be a way to virtualize the expertise, to embed more into the machines, and ultimately for us as individuals to take on more or task shift where healthcare gets done. So here's just a few examples of the things that we're working on, and I think just the tip of the iceberg, and as I said at the beginning, I'm extremely bullish about what can be done here in India across multi-sectoral involvement, and certainly given the amount of engineering talent and the rising entrepreneurship, I'm excited for what the future of healthcare will be, not only in India, but what India will give to the world. So here's an example. I wish I had the actual movie, but it's the ability for us to use virtual reality in healthcare now. So this is an example of where we take very sophisticated magnetic resonance signals and can create actual real-time, three-dimensional, any-angle view of the hemodynamics and the wall function of a heart. One of the most important pieces of how do we understand what's going on in a heart. We want to know about the electrical properties, and we want to know about the hemodynamic properties. If we get those 2 things right, your heart works properly. So this had never been done before. It is a huge amount of computing power. And when you give that to a clinician, it makes it come to life for them, and they're much better at making the right diagnosis for the patient. But it is gigabytes of information in a virtual model that replicates what is actually happening in the body. Another example is using machine learning to help us either organize the work or take the easier parts of the work and make diagnostic guidance systems. So this is an example of how we use machine learning with, a big data lake around a certain amount of clinical information and allow the machine to learn. And this is a very exciting area. There's lots of companies working on this. I just reviewed a project last week where we're giving an X-ray, a chest film, can now, with an 80% accuracy, detect tuberculosis. Massive, especially for places like Africa and India and South Asia. And we're working with a number of groups. The project here for a detection of pneumothorax. Number 1 reason people come to an emergency room, second from a stroke or a heart attack, is distress in breathing. So if we could have an easy way that the patient walks in, we do an image, and we can determine whether they have a pneumothorax, helps us triage those patients and makes the workload on the system much lower as well. This is where I'd say in literally 5 to 10 years, a lot of radiology will be done with the assist of a computer. It's not good news if you're a radiologist maybe, but it's certainly going to be great news for the 5.8 billion people who lack access to good quality radiology. Another interesting idea, and I think it's maybe not as glamorous in some level, but is how do we embed sensors and edge devices to create a digital twin of a machine? And when we do that, we can then optimize that machine using predictive analytics. So let's say I've got this expensive piece of equipment, whether that's a linear accelerator or a robotic surgical system, or in this case, an MR. In a market like this, and what we need to do to make it affordable is volumes of patients need to happen. That's the economy of scale that makes it affordable. And when we look at this, anytime a machine goes down or a machine's not being used to its optimal capabilities, that's a lost opportunity to use that technology to its fullest extent. So we are working on this where we build sensors into the machine, put edge devices, that data exhaust is coming up to the cloud, and we're using that then to replicate in a digital form, or a digital twin, if you will, the functionality of the system, the optimization of that, and then being able to predict, hey, we can see that there's an early signal that this machine's going to fail. Let's go fix it when it's, 10 p.m. on a Sunday night when there's a period of time and it won't disrupt the clinical care. Take that idea now to a whole systems level. We have a project with Hopkins in Johns Hopkins in Baltimore where we have built an entire, if you almost think about it, an air traffic control system. So we took their 14 hospitals as well as their over 200 clinical hubs, and that's been pulled together that it has there's about 200,000 different workflows, patient workflows in a healthcare system. So with all this information, we're actually helping them optimize the utilization of their surgical suites, of their personnel. When an emergency patient comes, instead of going to a place where we already know the system is full, we can redirect the ambulance. They have a command center, as we call it, the wall of analytics, and they can actually see out almost 2 weeks ahead of time. So they have a chance to change something that's in their system to better utilize the asset base that they have, both the people and physical assets. So another exciting way, and when we worked on this with them, I was just there about 8 months ago, and it's been a phenomenal change in their system because, again, most healthcare people don't think like operations research people. The idea that, you have all these different specialties, individual physicians, everybody's kind of working in a loosely stitched together cottage industry fashion. So when you apply something that is like an operations research project, you really get to see how the flow of everything's happening, and now they're adding to this the flow of their consumables. So their supply chain is being optimized around this as well, which, again, in many hospitals, that's one of the biggest pain points. When do the clean sheets arrive? When do I have enough, gauze and bandages? When do I get the right drugs in stock and don't let them expire? Another project that we've worked on here in India, which is also really exciting, is building a cyber-secure, ready-time access to the information of radiology. And again, because we lack enough expertise, the MAC system, as they were expanding, really wanted a way that they could reliably give access to any image that was acquired at any time with the analytical tools that they would like to have. So it's not simply just passing an image over, but actually giving them access to the applications if they want to further evaluate the diagnostic information. So this was a massive project. It's all cloud-based. It's given them scalability. It's given them efficiencies. And they would readily admit it's given them better clinical diagnostic decision-making because they have now the ability to quickly grab an expert and have them look at a particular case. They don't need to physically go to the location where that patient is sitting. Now, one of the other areas, and I hope that a lot of the people in this room that are working on ways we bring technology to the rural population. As I said, in Africa, it's about 70% of the population is rural. In India, it's about 600 million, or 50%. We know that there's a lot of ways we can change the dynamics. We did a study 3 years ago. The average inpatient, if you take the semi-urban or urban areas of India, the 22 biggest centers, the distance traveled by an inpatient, 40% of those patients traveled more than 250 kilometers. Now, think about the consequences of that. It's time away from work. It's usually somebody else from the family has come, the cost. And then not to mention if you're really ill, it's hard to be away from all the people that care about you and want to be, there to support you. So we are really excited by this. And let me just give you a few examples of what we've done. And as I said, I think this takes a whole village of entrepreneurs for us to really crack this and make a substantial shift such that people in places where they live can gain access to the same technology and the same expertise that you and I do. So in India, there's approximately 43 million people that have heart disease. Each year, approximately 5 million people have a heart attack. And unfortunately, not very many people survive that. And if you look at the data, there's at least a third of those heart attacks that 1 million people should survive. And they don't for a lot of good reasons, but let me argue that one of them is we don't diagnose that they're having a heart attack. So we've worked with a company, and this is, again, the partnerships here in India. We are extremely open to being partners with people in the ecosystem. TriCog is a startup company in the healthcare space, extremely talented clinicians as well as technicians. And we have designed a system where we're taking the algorithms that we have around heart signals and coupling that with a business model. So the patients in the rural sectors can have an ECG done, it's machine read, it's transmitted over the cloud. Within 3 minutes, a cardiologist, their service cycle is within 3 minutes or less. The person who's had the ECG gets an expert cardiovascular interventionalist opinion. In the first month that we did this, and it was a fairly small pilot, documented 32 people were saved as a result of this. And I just think about this as in so many ways, it's a simple, small number of rupees per study done that saved 32 lives. Multiply that on the scale of 43 million people in this country who have heart conditions. I mean, it's a great ROI. It's a great ROI. But what it means is ECG, and listen, there's hundreds of companies that do ECGs. That's not the hardest part of this. It's actually the algorithmic side of it, to be predictive about what's going on. I could probably go to any IIT campus and someone can build an ECG machine. It's what you're going to do with that signal, it's the quality of that signal, and it's how you interpret that signal that's going to matter to the outcome of a patient. Oops, sorry. Another project that's really exciting is, again, how to bring virtual expertise to rural areas. So we've brought all of the information, the exhaust from an intensive care unit, into a machine that organizes that, analyzes that, and provides the ability for, today we have about 1,100 intensivists in the country that are board certified intensivists. That is certainly not enough. We need at least 100,000. So how do we help? Well, if I'm an intensivist today, I'm probably physically able to take care of 10 patients, 10 critically ill patients. Through this type of model, as an individual intensivist, I can comfortably take care of about 150 patients. And as this becomes more sophisticated, I think we can expand that even. So we're working on ways that changes the outcome, brings down the cost, and extends the capabilities of this type of healthcare system to places beyond the urban boundaries. Another very, in some ways, simple idea is a portable ultrasound. But not just the fact that it's a portable ultrasound and it has, been designed to withstand a lot of, a ride on a two-wheeler in a monsoon and, battery operated and many of the things that we had to think about. But inside of it is built to send all of its information to the cloud. It's actually onboard coaching, scan coaching. It's the opportunity for someone who isn't a trained sonographer to be able to use this machine with some minimal training. And what we targeted on this is it's not to do everything, the limited scope of what it can do, targeted at a particular area of care. And I think that's another interesting concept for us to consider is we have a lot of technology. If we want to bring the cost of that down, we should really think hard again, going back to what I started. What problem are we trying to solve? We're not trying to solve everything. We're trying to solve some very specific things. So I can put this in a mode for a prenatal exam. We did this project, we rolled this out in the state of Kaduna in Nigeria. And I went there, and by the way, the night I arrived, I went to the maternity ward, which was really looked like a stall we would keep, livestock. And a woman was in, difficult labor, and night was coming, and no drugs, no technology. The sun was setting, and the physicians were working with the light of their phone. And unfortunately, this woman died. Now, when we thought about this, we said there's something that we should have been able to do in a way that would have made that chances for that mother to survive her beautiful event of giving birth. All we needed to know was that baby was in a breech position. She should not have tried to have birth in her village. She should have been moved to a place where she could have had a C-section. So when I talk about these things, there's excitement around the technology, but at the end of the day, we're really thinking about what technology is needed to make a different outcome happen. I can't design a system that I need a regular doctor to use. There's not enough of them across the developing economies. I need a system that I can take a midwife or a village ASHA worker, and with proper training around a narrow scope, he or she can then do something that will ensure that we have better outcomes for mothers, for babies, and for our general population. So, great example of something, and again, we're using this across. We're also able, because it's cloud-enabled, we can actually go back and find the people that are not using it as properly or need some more additional training. So it's a lot of ideas around, again, not just the simple piece of a diagnostic, but actually what do you need to have as far as the entire 360 to ensure that we have better outcomes. And by the way, this platform is just a fraction of the cost of what we have in our bigger machines. The other thing that I am also quite excited by, last September we launched an incubator called 5.8 for the 5.8 billion people in the world who lack access to care. Our idea here is targeted at startups that are already generating some revenue, so you've got a product, you know something's got some traction in the market, kind of in the post-Series A stage of your company, and now you're poised, ready to go, but you're really not sure how you can commercially scale. And I think that's what value we can really bring is we know how to take things into these markets, how to get them through regulatory processes, how to have set up the post-market support and surveillance, and really how to market and position these in some of the big projects that we do across the world. So we're really excited. We've got 3 companies that we started with. I think they're all, we're quite pleased with them. And I think you'd be quite surprised at how little we're actually wanting from this. We're really just trying to help bring, if you want to think about in a care area scenario, we're looking for things in cardiovascular. We're looking in things in the cancer care model. We're looking for primary and referral or mother and child. So we're looking at who can be part of the ecosystem with us, because we certainly will never have all the pieces that it will take to serve the population. So very excited. We're Also, and I think this conference is really important, is I think that there's not ever been enough support to the medical community or the startup in the medtech space in India. It's pretty hard, in fact. So if we could bring together the like-mindedness of which, you know, groups like ours, yourselves, the governments, institutions, we don't do enough research in the country. I think that's another thing that was mentioned at the video. And there's certainly a lot more, I think, could be proven in India through co-creation. I think co-creation is, in the healthcare space, given its complexity, given the nature of it, I think is another really important concept, and we're excited to be a partner in those kind of relationships. So I'll end there. I think it's probably one of the most exciting times in healthcare. As I said, I've been at this, my first job ever as a 17-year-old was in a hospital. So I've loved this from the very beginning. It comes naturally. And I think we're at the, you know, kind of at the beginning phase of a digital transformation, but one that will be certainly the most disruptive but most positive to the outcomes of health around the world. And I would hope that as we look forward, that from India, I wish I could come back here 10 years from now, and this room is, you know, quadrupled in size, and we're exporting around the world cost-effective, innovative, digitally enabled solutions for healthcare. So thank you very much for the invitation to be here, and all the best to everyone.